supporting bold ideas with big impact. We're funded by the Government of Canada and other partners. We fund innovators with lived experience of the challenges and contexts where their solutions are meant to work. Low and middle income countries, conflict zones, Indigenous communities in Canada, and the bold ideas that Grand Challenges supports integrate science, technology, social, and business innovation as something we refer to as integrated innovation. We're one of the largest impact first investors in Canada, having supported over 1,300 innovations across 106 countries over the last decade. Specifically, the work that we do in mental health, we launched our first call for innovations in global mental health in 2011. And the goal at the time was really to seed and transition to scale high impact innovations that support the mental health needs of individuals in low resource settings. At the time, we invested over 40 million Canadian dollars from the Government of Canada and supported about 95 projects with that. It was one of the, at the time, it was one of the largest portfolios in global mental health innovation in the world. Today, luckily, there's a lot more funders, though arguably not enough, that are pooling capital into the space. Today, we have new funding from the National Institutes of Health Research through the Department of Health and Social Care in the UK to continue and to grow the portfolios. And the solutions that we support are, we're seeking for innovations that meet people where they are, that integrate mental health in primary care, provide services in schools, leverage digital tools while maintaining quality of care, et cetera. In terms of the topic of today's conversation, funding in the mental health, global mental health ecosystem, it's obviously no surprise to anyone on this call, I would imagine, but mental health is considerably underfunded, in particularly in low and middle income countries. It's true for philanthropic funding, it's true for development assistance, and it's true for government funding. So that's the first issue. Second issue is that funding's allocated differently in different geographies. So for example, 70% of total government expenditure on mental health was allocated to mental hospitals in upper and lower middle income countries compared to 35% in high income countries, suggesting a greater need for deinstitutionalization in low income countries. And finally, for the individuals in low resource settings, they don't have the same access to services. And when they do, they don't have the same financial supports to access those services, where in lower resource settings, over half are reporting that people are paying mostly out of pocket, if not fully, for services compared to high income countries. And that gap widens when you look at expenditures on psychotropic medicines and other treatments. So, I think the one bottom line statistic that we continue to go back to is that globally, less than 2% of national health budgets is allocated towards mental health. In low and middle income countries, it's often between 0.5% and 1%. And the majority goes to mental hospitals and psychiatric facilities and doesn't meet the needs of communities and individuals where they're at. And so these stark statistics, just to wrap up this section, these stark statistics represent key challenges, but also opportunities for intervention. And as a funder of global mental health innovation, Grand Challenges Canada's goal is to work with local innovators, seek out and listen to those with lived experience. They have the best understanding of what is needed in their communities, but also recognizing that there is a lack of funding in the space. We also seek to anchor our investments and seek out other partners like Grand Challenges Canada in order to share risk across institutions to try and bring more funding into the space where it's critically needed. I'll stop there. I'm sure there's time to go into more detail later, but hand it back over to you, Devika.
Thanks, Tina. Next up, we have Priti Sridhar from the Mariwala Health Initiative. Priti Sridhar is the CEO at the Mariwala Health Initiative, which is a grant-making and advocacy organization in the mental health space in India. Preeti leads MHI's rights-based work and oversees project management, grant management, and advocacy initiatives. She has almost 25 years of work experience in both for-profit and non-profit organizations. Over to you, Preeti.
Thanks, Devika. I think when we talk about inequality in funding and in accessing mental health uh, funding globally, it is important to start this discussion on a recent survey that International Association for Mental Health Research funders had done, which said that only 2.4% of the total mental health research funding was coming to LMICs. It, of course, also highlighted the fact that 98% of the funders of mental health are based in high-income countries. Now, even within this 2.4% of funding coming into LMICs, research related to substance use and dependence received the most funding at 19%, followed by depression at 9%. Mental health issues as obsessive compulsive disorders and personality disorders, self-harm, each received less than 25 million per year or less than 1% of the total expenditure. Now, as we all know, self-harm and suicide account for over half of all years of life lost due to mental illness. Yet, the analysis showed that it received one of the lowest levels of funding. Apart from this, there are some other statistics I think that we should look at. There's a large US-based philanthropic organization where 88% of its funding went to the wealthiest nations like US, Canada, and Australia and EU, although their work is to be focused on LMICs, including India. Similarly, the biggest donations in education in the US in 2019 went to the elite universities and schools that the philanthropists themselves had attended. So, what does it tell us? It tells us that the funding, whether it be in mental health or in other sectors, are going to a certain group of individuals. If we even look at the global south and we look at who are these NGOs and CSOs that are receiving these funds from the global north, we will find that these are with the founders who have caste, class, gender, education, and English language as a privilege. It's also to NGOs where the founders have had either studied in these developed countries or have worked in these developing countries. So, what does it tell us about giving in general? It is that it is still about privilege, power, and access to networks. And it is not just about the divide between the global north and south, but also within LMICs. Even if you look at the data in India, then we see that a majority of CSR funds go to states with the highest level of industrialization, which are already resource rich, like Maharashtra, Karnataka, and Gujarat. CSRs or funding agencies in India don't necessarily see beyond rural, beyond what their area of functioning is. And as a result, rural, tribal, and Northeast based NGOs suffer from lack of access to CSR funding. And this disparity can contribute to, again, the rural urban migration and thereby increasing the burden on urban systems. Um, Giving funds to large NGOs or organizations that have privilege is problematic. It is so because these organizations already, because of their privilege, are able to attract the best talent and invest in overheads such as marketing, communications, while grassroots NGOs that tend to work on service delivery among the most deprived population and that in the Indian context work to bridge government incapacity of programs like Minegram miss out on these funding. Similarly, there is also lesser funding towards probably rights-based organizations or collectives. This could be because they may seem like politically risky as they campaign against government policies or campaign for change in laws and policies. And this leads to what I would say a more market focused model of development that doesn't often challenge power structures such as caste, class, and privilege, which are required when you're looking to work on rights based mental health services. When we look at this both at the global level and at the national level from an international development perspective, this stems from a colonial mindset on how foundations and funders in the global north view the developing world. This mindset continues in domestic philanthropy, where philanthropists and funders see themselves as benevolent givers and program participants as receivers, rather than focusing on rights-based work, which from a program design is sustainable because it pushes the government to take responsibility and provide for rights of people, including right to mental health. In mental health funding, and here I'll limit myself to what I see in India. Funding from the global north is directed towards NGOs that are funded by privileged backgrounds of caste, education, geography, have have had the experience of managing large budgets. And again, this is a cyclical thing in that manner. May or may not have a rights-based approach, but work more on a biomedical model, have expertise on a research component, and have worked in a resource-rich setting. And this takes out a lot of smaller grassroots level NGOs, which don't therefore have access to this funding, whether from the global north or from the local funders in India. So yeah, that's what I wanted to start off with. Over to you, Devika.
Thanks, Priti. That's a lot of really, really interesting and I think challenging questions that you've raised. And I hope that we can come back to these in the panel discussion. We move on now to our third speaker, Dr. Ricardo Araya. Dr. Araya is a professor of global mental health at King's College London. His research interests include the etiology of common mental disorders, inequalities and their link to the mental health of populations, with a special emphasis on international comparisons and effective treatment for common mental disorders, such as brief interventions using non-medical delivery agents and strong community participation. Over to you, Dr. Ryan.
Okay, well, first of all, thank you so much for inviting me. Something that you forgot to mention is that I have had a long commitment and I have worked for many years with Sangath. So I'm delighted to be invited to celebrate the 25 years of Sangath. Well, first of all, I'd like to say that when it comes to inequalities for funding mental health research, the way I approach this is by saying that there are so many layers. It's like an onion of inequalities that you need to explore and eventually dismantle. A disclosure, I've been in this business for about 35 years. So what I'm about to say that are part of my personal experience and opinions after having sat in so many committees and panels over the years. Let me just say, first of all, a comment about the overall situation. I think, for those of you like me who started 35 years ago, you have to realize that, at that time, there was virtually no funding whatsoever. It was dismal. So it's incredible that some of us actually managed to stay the course. I have to say that probably around 2010, there was a big change and a lot more money was coming for global mental health research for a number of reasons. And more recently, I would say over the last 2 years or so, things have taken a really bad and nasty turn. Government, well, you know, it's the pandemic, there are other priorities, government are withdrawing in different ways their support for global health research, and in particular to global mental health research. So things are getting tougher. There are still some kinds of organizations, mostly private organizations, which are attracting funding, essentially raising funding from rich donors. And well, obviously they have their own agenda, which is more to do with advocacy and reports and God knows what else. But they do have their own agenda. You know, one of them, you know, is decided that they're only interested in investing in Nepal and Malaysia. Another one only wants to fund work in Rwanda. Another one is only interested in autism because some family of one of the main donors, you know, have a member with autism. So it's just all kind of like very messy on that side. So let me just start by all the layers of inequalities. You know, first of all, I have to say that it's already been mentioned that priorities in general are decided mostly by those who hold the wallet. And since usually government or even private organization, as I mentioned just now, sometimes people from low and middle income countries are invited to give opinions, but in general, the decisions are not made by people from low and middle income countries. You know, some people say fair enough because it's their money and, you know, they're answerable to their own taxpayers. So, you know, let it be so. Is a pity for low and middle income countries because a lot of things are missed. Another layer of inequality comes when government decide to allocate money to global health research, and they set up their own committees, committees where mental health experts are often underrepresented. And these funding committees tend to, you know, give prominence to physical diseases rather than mental health problems, let alone any kind of sort of social approaches. One other layer of where, you know, that can sort of show why inequalities are being introduced is that when you sit on panels to review projects, it's quite easy to note that some of the groups that are sitting there in the panel around the table are in a much better position than others. For instance, you know, it's always been striking me that there was so much money invested in infectious diseases such as malaria or HIV. So when you are on a panel that takes everything on board, those working on those fields are in a much better position to put stronger bids than those in the mental health field that has been historically neglected. And therefore, at the end of the day, when decisions are made, you know, mental health doesn't come very strong. Some people haven't even argued about positive discrimination or close calls. When the same applies, you know, for those people reviewing grants, you know, you've probably all been through that experience, you know, that there are some people that you simply, you know, think, you know, what the heck are they talking about? They don't simply know anything. More recently, there's been quite a lot of emphasis from funders to say that there should be equal partnership. But to be perfectly honest, I don't see that happening. It's just simply lip service. There are clear asymmetries in the groups, you know, when you look around the world, you know. And sometimes, you know, you come across with projects where less than 10% of the scientists are from low and middle income countries. There are many reasons to explain that. But, you know, the idea of equal partnership, it's, it's just an idea, hasn't materialized in my view. When it comes to the distribution of budgets, they're obviously unequal, and sometimes you find, outrageous projects where, like, sort of most of the funding goes to the high-income countries, and only a small proportion to where the work is going to take place. Often, expectations on funders from high-income countries are quite unrealistic. For instance, they want to have a lot of emphasis on community participations. Some of them that haven't got a clue what it's like, communities, have been neglected in most countries, low and middle income countries around the world. And it's difficult to find organizations that have the capacity to work designing projects. Yes, of course, smart researchers put names on the proposals, and, therefore they manage to tick boxes. Finally, same applies when it comes to governance and ethics. And you have to follow the rules of the country donors. Often the requests are nonsensical. Such, for instance, I've often come across with, requests for safety protocol that would make a lot of sense in the US, but are impossible in resource-poor settings where there is virtually nothing to provide a safety net at the level that is required in the US. And with that, I stop. Thank you.
Thank you. Again, I think some really, really good points and excellent questions that you've raised about funding and what does a meaningful partnership between the global north and south mean. Thank you. That brings us to our last opening statement from Dr. Soumitra Pathare. Dr. Soumitra Pathare is a consultant psychiatrist and the director of Center for Mental Health Law and Policy at the Indian Law Society, Pune in India. His primary interests are in the areas of suicide prevention, mental health policy, scaling up mental health services, rights-based care, and legislation. Over to you, Soumitra.
Hi, thanks, Devika. Thanks for the invitation and congratulations to Sangath for its 25 years. One of the biggest advantage of speaking last is everything has been said before you, so it makes your life extremely easy. All the intelligent stuff has already been said, and you just have to wrap up things very quickly. So that makes my life easy. I also wanted to kind of put up right away that I don't know if this is a COI disclosure or what, but there are two of my funders on this panel who have funded us for a substantial length of time. So just wanted to make that clear to everyone. I just want to explore some of the things that Tina, Ricardo, Priti raised in their talks. And I think what we see in terms of disparity in funding between health and mental health, there's a huge disparity in how much money goes to health versus mental health, which we've always talked about. We see the same disparity in funding within mental health. And that disparity which we see within mental health from, say, the high-income countries versus the low-income countries is then replicated within the low-income countries between different groups, like what Priti mentioned. So what I find is that while we get rid of a layer of discrimination or a layer of inequality at one level, that layer just shifts to another level. So when we are talking about inequality, I think we need to talk of inequality at all levels. So I was going to try and make my opening remarks in three categories. Let's start with the who gets funded, because that's always an important issue, and that depends on which lens you apply. If you apply the lens of research, whether you apply the lens of services. And I suspect what happens is that when it is the lens of research, then who gets funding is clearly disparate. A lot of the funding does go to high-income universities, which will do the research. And very often there is a gap between funding between research organizations and service provider organizations in those low and middle income countries. That you see all the time. So what will happen is funders will fund a research project. At the end of the research project, everyone packs their bags and goes home, and nothing has really happened. So I do think that there's an ethical issue for funders who are funding research to ask themselves what happens after the research is over. What happens, and if you found something is very useful, and let's say the research shows that something works, then who carries the moral responsibility for ensuring that those populations which were part of that research actually received that service? That's something that we don't know who can do, and who should be doing it. Let's see, what gets funded is another big issue. Priti mentioned this point about what does get funded, and research funding is usually prioritized over service funding. There's this obsession that funders seem to have with innovation. It's become the buzzword. Everything has to be innovation. Now, my question about innovation is very simple. Uh, when we are not scaling up programs, when we are not scaling up interventions for which we already have good evidence, why are we going around doing even more knowledge-based, innovative things? Why are we not innovating for service delivery? Why are we not focusing our innovation on doing things that we should be doing, for which we have good evidence? Someone long ago did a very interesting mind experiment and said, like, what if you, and they did it for cardiology, and they said, what if we stopped all new research in cardiology and just implemented all the interventions that we know which will reduce heart attacks, and how much good difference would we make? And they came up with a figure which said 50% of heart attacks could be avoided if we just did what we already knew. And maybe mental health needs that kind of a question to be asked today. What if we all directed our resources, energies to just implementing things that we know already? How much difference would we make? Uh, where things get funded is another important. Hold on, somebody's just trying to call me on my phone or Telegram. I need to cut them off. Sorry. Where things get funded is another big issue, and many countries have now kind of said that they will spend 0.75% or 1% of their GDP on overseas development assistance, and these commitments exist everywhere. What countries have done is they've actually said, and many countries, without naming anyone, have moved that ODA onto funding for research. Okay, and so they've said we are funding research in low and middle income countries, and we are using our ODA and meeting our ODA commitments. Now, if you look at these programs and research programs very carefully, they will always insist of an in-country partner, as an in-country partner in the low and middle income country where work is done, but that the project will be led by a partner who's based in that high income country, which is usually be a research partner, will be a large university in that country. And they have restrictions such as 50% of the funds have to go to that high income country university partner. Now, this to me is just a little bit of a scam, actually. What you're really doing is trying to use the ODA money to fund your own universities, while at the same time claiming that you're giving away X percentage of your GDP to ODA. I mean, this is just an accounting scam. Instead of funding your universities directly, you try to use the ODA money to fund your universities. So I think we need to really call out some of these practices that many large funders are indulging in. And finally, one of the things that really worries me about funding that goes on is what are we funding for? So even if you apply for research funding, uh, it is far easier to get research funding if you are applying for what are conventionally called as mental health treatments. Okay, or if you're asking for funding to find the causes of mental health problems. There's a huge amount of funding for biological research in mental health, for example, a huge amount of funding for treatments. What I find very difficult, and this is something that we found very often when you apply for research funding, where if you say that your interest is in social determinants of mental health problems, if you say, I want to do an intervention which reduces unemployment, and so it will reduce mental health funders are just not interested. They say, oh, we don't fund that. We fund mental health treatments. And I think there's a question that we should be asking ourselves, that why should mental health treatments be so narrowly defined to be just clinical or health related things, when we know that really what makes a huge difference to mental health outcomes is actually the social determinants of mental health. I think I've spoken for long enough. I'm going to stop here and let Devika take over for the discussion.
Thank you, Soumitra. Once again, I think really, really good questions that you've raised in your address, and a little bit of scam calling. All right, so I think thank you all for your opening address, and I think you've given everyone who's listening a lot to think about, and perhaps ask you more questions about. We'll now go into the panel discussion for 30 minutes. My first question that I had planned to ask was, what are the challenges that countries in the global south are facing related to funding? But I do feel that that question has been answered to quite an extent through your opening addresses. But I would still ask, does anybody want to add anything apart from what you've already said in responding to this question?
Devika, can I just add something? Because I don't think any one of us actually brought this up. And when we are talking about lack of funding for mental health in low and middle income countries, let us also please call out the governments in low and middle income countries, which are not actually putting in the money that they need to put in. So if they're going to try and depend only on international assistance and depend on international funders to do the heavy lifting, that's a completely and appallingly wrong. And nobody wants to say that that governments in low and middle income countries are not doing right by their own citizens. I suppose living in a LMIC, I'm probably placed in a position where I can say that without being accused of all kinds of biases. But that is something we've just not done. You know, the inequality is not just between high income and low income countries. The inequality is within the low income countries too. So countries will fund medical health research, but will not fund mental health research, for example, or countries will fund health services, but not fund mental health services. And I think we need to call that out too.
Absolutely. I completely agree with you, Soumitra. Ricardo, you have something to say. Please go ahead. You're on mute, Ricardo.
Yeah, I totally agree with Soumitra. I do see it in some panels in middle income countries, on a couple. And I have to tell you that it's even more difficult to sell mental health in those countries than in the high income countries where I sit in panels.
Absolutely. Yeah, and perhaps all this international funding precludes the government from this responsibility, because they feel that to some extent it is being taken care of from money that citizens or in organizations are attracting. Yeah, Priti, go ahead.
Yeah, I think I wanted to make 2 points that probably have not been made. One is when we're talking about receiving grants or even applying for grants from which are global grants. One of the challenges that people face, and this is based on what I hear from my partners, is who can apply for these grants. And apart from in the Indian context, the requirement from the government, the form itself, the language of the form, who comes to know that these are open grants available for people to apply, the type of questions asked in terms of what the interventions are, assume a certain methodology or a certain intervention. So I think that's a challenge that needs to come. And I think the other factor is also, how do I put it? most funders, whether they call it program, projects, or co-funding, are talking about shorter duration commitments. And that means, and drawing upon what Soumitra was talking about, social determinants, is high impact projects that take a longer time to show results. And especially true in mental health, where we are talking about challenging structures of oppression. We'll find it very difficult to show what would be a short term impact. More so, again, on if you want to talk about psychosocial approach to mental health. So I think it's also not just what type of interventions, and the way the grants are structured to probably give an advantage to certain types of interventions, but also this measurement of impact needs to change in the eyes of the global funders.
Absolutely. That's a great point, Priti. And I think that I remember that I think you mentioned that, sometimes funders are chasing metrics more than they are change, because change does take time. I'm just wondering, Tina, if you would want to add anything to the point that Priti just made about how accessible some of these funding calls are to people in the global south that want to apply, that perhaps have ideas, but something about the preference for impact or the preference for the intervention that precludes them from applying.
Yeah, so all very, am I off mute? Yes, all very good points made by my fellow panelists, and not anything that we necessarily haven't heard before, at least as a funder in mental health at GCC. These are all things that we're actively trying to address through our evolving model. If you look at GCC 10 years ago versus today, I think it's changed quite a lot. We do have an increased focus today on supporting locally led innovations. About 80% of our funding goes to LMICs directly. How that's distributed via subgrants is a valid concern that's been raised, I think, by Soumitra or Ricardo. But the vast majority of of Canadian taxpayer dollars goes to LMICs directly, and if not, to Canadian-based institutions. Now, one of the things that we are trying to improve upon, and I would welcome any suggestions from fellow panelists or attendees on the call, is how to improve our ability to or enable or support applicants from LMICs to apply and to put their best foot forward, in the sense that their applications don't get scored out by people, as Priti mentioned, who have privileges like English language fluency or things like that, because that's something that we're actively trying to address in our application process. We've thought about doing, and we've actually made available additional resources during application periods for non-English speakers to try and boost those numbers. That's marginally improved the success rates of say Francophone applicants, for example. That's one jurisdiction where we're not a huge funder, so it's impossible for us to make these supports available across the board, but we're trying to pilot some of these approaches to improve success rates among the groups that really are the right stewards of the communities that we're trying to impact. So I'm open to thoughts from panelists and attendees on how we can do better at that. In terms of impact metrics, I mean, we are a largely government funded organization ourselves. And the truth is that the metrics that we seek from the innovators that we support are the same metrics that we report on to our funders. So lives saved, lives improved, the total number of beneficiaries reached, for example, those are all flowing down essentially from our funders. And it's not just the government of Canada. Grand Challenges Canada receives funding from multiple international governments, and I'd say across the board, there's a similar level of interest on those types of metrics. So that's my answer on that one. I do also want to say that in terms of right sizing, right shaping, the applications, the open RFP processes themselves, that's also something that we've been working on. But the point about, not asking the right questions for the type of design or the type of work that's being conducted, to Priti's point, is a good one. And over the last, I would say 2 to 3 years, we've been trying to include more individuals with lived experience in the subject areas that we're investing in to help us design some of those application forms. Are they perfect today? Probably not. Can we do more work on it? Definitely. But it's a process we're actively undertaking, and not just about the application forms, but everything from the RFP, what goes into the RFP, what are the priorities that we look to support in the RFPs. We don't decide on those internally at GCC. We engage in a consultative process that informs the design of the RFPs. We include people with lived experience, former innovators, experts, all from LMICs on our innovation screen panels, on our external review panels, on our investment committee, and on our board, and on our program advisory council. And so all along the way in our programmatic life cycles, we are looking to incorporate the perspectives of people from the communities that we're looking to support. Again, can we do more? Absolutely. And I would be very open to feedback from the panel or the audience on that. So hopefully that answers, or that addresses the question.
Thanks, Tina. Yeah, go ahead, Ricardo.
Yeah, no, first of all, I want to say that I was one of the lucky ones with GCC in the 20s, early 2010, when they launched, when there was quite a bit of money there for mental health during time of Peter Singer. So I managed to get quite a few of those. And I also sat in panels for GCC. And I have to say that, I was very impressed by the effort made by GCC of inviting people from all over, many different low and middle income countries. Probably it's the most representative panel that I have sat on. I have sat on many, but actually, in terms of low and middle income people. The one thing to say about that, there were interesting things about that panel. One of those that they've been, is unique. I had never seen it before. They bring business people to give an opinion, and there were massive discrepancy between what the scientists were in there and the business people, and in the end, it was very difficult to settle those accounts. The model that used to work in there, it was that, at least it did for me, is that there were kind of sort of innovators in low and middle income countries, but they were unable, they didn't have the capacity to put forward a proposal with so many technical things and in a language that it was acceptable for GCC. So I became that person, the person who did that. And I think, many of the grants that were given at that time, there was always a senior person with a very good track record that did that work. And then there were all the sort of innovators in there. And it seemed to have, well, at least in my case, of the 4 projects that I had, all of them had publication. One of them is a friendship bench, has become quite famous. So it's, I think, since you are in innovation, Tina, I think it's a good opportunity not just to think about innovation in terms of research, but innovation in terms of funding more mental health and funding more successful, because that's something that you often forget, that many of these organizations don't even bother, really to go and look whether or not their investment, really gave, an impressive yield. Thanks.
Thanks, Ricardo. Soumitra, you had your hand up. You're on mute. Yeah.
Thanks. I was just going to respond to a few things both Ricardo and Tina brought up. Firstly, Tina, I really do think that just as we need capacity building for the innovators and researchers to write better grants, I think there is a need for capacity building of funding organization staff to understand the complexities of the issues that are there in very countries. And many of us could actually, with our lived experience of having lived and worked in these places, very seriously informed and build the capacity of funders to do a better job, because I see this as a partnership. It's not about us and them kind of a thing, but it's as a partnership. And just as we need to build the capacity of innovators, we need to build the capacity of, because I find very often the funding agencies, the top level decisions and plans which are made are all wonderful and great, but when it comes to actually implementing it on the ground, when it's the staff in the funding organizations are making those decisions, that's when the challenges come. So I think it would be a great idea to even build their capacity to understand the complexities of what they are dealing with. That's one thing. The second thing is, I just wanted to say that, we are talking to a bunch of pretty enlightened funders here. I mean, GCC and Mariwala are probably among the better, or one of the better funders around in the world at the moment, who really do a very thorough job of what and who they fund. And I don't say this only because I've been funded by you, and I made that clear right at the beginning. But the fact is that, what we really need to be talking to is the funders out there who are not here, who need to listen to some of this stuff that is being discussed. And the third thing was, I do think that this whole idea of applying for a grant and then the notion of merit, which is to do with the merit of the proposal, and that the most meritorious proposals get funded. That is a very naive way of how we go about doing funding, because what is merit? What is the definition of merit? And anyone who's lived in India would understand all of that. If you're going to if you're going to reduce down merit down to how well you did in writing an application form, then it is all dictated by your different starting point. What Priti said or what Ricardo said, you speak English, you come from a privileged background, you already have lots of advantages. So merit is, when you don't have an equal playing field, when you don't have the same starting points, how do you then say, oh, the most meritorious proposals got it? And secondly, to make these into hyper competitive way of delivering funding also creates a lot of problem. I know many funding organizations, many NGOs now, for example, for example, in our organization, I know that we're probably successful 1 out of 4 times. So if we write for 4 grants, we'll be successful for 1, which is a pretty good rate, I think, because many of them don't even have a 1 in 4, they probably have a 1 in 10. What it does mean is the amount of effort that is wasted, and what happens to those 3 ideas which were supposedly wonderful, which never got funded. And how do we kind of then collect up and scoop up all of those 3 ideas which a particular funder didn't fund, but somebody else might have found very interesting to fund? So I do think that we need to really relook at the entire process of how this is done. This is the old traditional way it was done. Funders put out a call for proposals. People will apply, there is a form, and then there's a way of evaluating it, and then some people get it and most people don't. Like, I know GCC will get 200 applications and they'll probably end up funding 10. Doesn't mean the remaining 190 were bad, but clearly there's a limitation to what GCC can fund and what happens to the effort put in by those 190 odd teams across the world. That seems to be a very wasteful way of doing the funding. I don't have a solution for it, but I just want us to at least think about how this could be done a little bit differently.
Thanks, Soumitra. I think great way to kind of wrap up the discussion that we've had on this first question. There's two sort of branches that I want to pick up on from this discussion. The first is about thinking of approaching. Oh, sorry, Tina, you raised your hand. You want to say something before I move on? Yeah.
Yeah, no, it's just, very quickly, it's a really interesting point, Soumitra, that you raised, and thank you, Ricardo, for your comments as well. First is, I think a funder's not a funder is not a funder. There's different funders out there with different purposes. GCC is an innovation funder. We're not development funders. So we're not like typical ODA funders. So our approaches will be different, hence the sort of focus on scale, the inclusion of the business perspective. And yes, it really does highlight some tensions between the scientific community and the business community. You rightly pointed that out. It's a little bit by design, not without its challenges, and we continue to improve on those. The point about the inefficiency in sourcing good ideas and the right ideas that we should be moving forward, that we should be funding, it's an interesting one. And I struggle with it because, on the one hand, you have funders that were referenced earlier who have a very specific focus, who only want to fund autism, or who only want to fund in Moldova or in India or in, certain parts of sub-Saharan Africa. And in those cases, there are practical, cost-efficient ways of sourcing and time-efficient ways on both sides of sourcing applications and good ideas. I think when you have a mandate that is quite vast, like GCC's, we've funded across 106 countries. We have a very big footprint at the seed level, and so we've made a high number of investments, and our approach is an open, competitive process, and so it's a little bit at odds. And yes, we do have situations where, with our global mental health call last year, I think we had over 1,000 applications, and we were only able to fund up to 25, I think, in the first round. So the competition is fierce. We weren't anticipating that, but it highlights the critical need for investment in mental health. But it comes down to it being a question of, do you want to be hyper-focused, or do you want to have that open mandate with the program? It's one I struggle with, and I just wanted to share that it's a tension that I'm in agreement with you, Soumitra, but yeah, it's hard to find cost-efficient, effective, time-efficient ways of putting out openly competitive calls such that it's less of a burden on either side. That's something we've been thinking about internally a lot. But thank you for your comment.
Great. Thanks, Tina. And I think you have partly addressed the question that I was going to ask, which is about, I think, the inherent problems with competitive funding, that you have to cast a wide net, and that means that sometimes you reach what is most accessible rather than what is most meaningful or where the need is the most critical. Great. Thank you all. I think that was really, really interesting. And I hope that you've helped our listeners think a little bit more, and maybe they can ask more questions as we move on. I'll ask my second question, and I think this is something that most of you have already touched upon. And I'll start with asking this question to our researchers, which is, since both of you did mention it and complain about it a little bit, which is, what does an equitable partnership between the Global North and the Global South look like? And you can answer it in terms of it being a Global North funder and a Global South recipient, but even, like both of you mentioned, institutions or organizations between North and South, when they collaborate, if you had to ask for an equitable partnership, a meaningful partnership, what would that look like?
I presume that question is aimed at Ricardo and me for some reason. I'll give Ricardo time to think, and I'll say a couple of things. One is 2 points really here. And I tweeted this earlier about a few weeks ago, and somebody said, "Oh yeah, this is great. We should do it." But I said I have not come across a global mental health funder who will fund a researcher based in the global south to carry out research in a global north country. Uh, you'll all laugh at it and say, "Oh, well, how can you do that? I mean, you can't really expect me sitting here in Pune, in India, to now go and do some research in London on the natives in London and to tell them how they're getting it all wrong. And maybe we could improve the systems for them." It's preposterous, isn't it? But maybe funders need to also start looking at that if we want to build equity, unless you really believe that all the expertise only lies in global north. And so there's no expertise in global south, and global north has nothing to learn from global south. And if it's okay for global north researchers to come and do research in global south, then why not have it the other way around too? I think that's really something that needs to be thought about and thought through. Why do you insist that it's always a one-way street? Why are we not? And there are plenty of disadvantaged communities in global north where which are equally disadvantaged as in global south. And so we should help them too. And I'm sure many of us researchers in the global south could really do a good job helping those communities in the north if funders were willing to support that. And the second thing that funders haven't really supported is a south-south collaboration. You rarely find funders who will want 2 or 3 south countries to get together and do something and maybe not have a north partner. Again, that's seen as not particularly attractive to funders. And so those are the 2 things that I would want funders to really actively look at if they want to really change things and make it a more equitable partnership.
Thanks, Soumitra. I think you're challenging everyone's internalized colonialism with that. Ricardo, over to you.
Okay, well, 2 quick reactions to what Soumitra said. I had been part of that kind of sort of experiment that you were suggesting first, Soumitra. It's interesting, how money can determine the rules of engagement. Because, there are countries like sort of, for instance, Brazil. Brazil has some, quite a bit of funding, at least the state of Sao Paulo. And then they have several programs, schemes in collaboration with funding organizations here in the UK, which are essentially funded 50-50. And I have been involved in a couple of things where the Brazilian researchers have had, a major contribution to what we're doing here in the UK with elderly people and loneliness, one that I can think of. So, but essentially, I think one of those things is that, the Brazilians feel empowered. Well, obviously in Brazil, Brazil is not a typical example of a low and middle income countries. They have quite a substantial research capacity, especially Sao Paulo, because of the funding. So that's, it can happen. And then you said something, I forgot about what was the second point that you said.
South.
South. Right. Once again, I'm not trying to make friends with Tina here, but we haven't met Tina, but I'm usually a friendly guy anyway. But when I did my thing in with GCC, I asked Peter and I can't remember what was the name of the woman who took over from Peter.
Kali Silver. Kali.
No.
Carly, yeah.
Yes, yeah.
Or
exactly.
Jocelyn. Carly, yeah.
Yeah, and then I suggested to them, because 3 of my projects were in Latin America, and I said, would it be possible for you to fund at least trips from one person from each one of those projects? When we were meeting in Colombia, the people from Peru and Guatemala will travel and join us for the meeting. When we were meeting in Guatemala, the people from Colombia and Peru will travel and meet us in there. And I think it was a really an amazing experience for all of them. And it really, not only in terms of capacity building, also in terms of empowering and learning from each other. Setting your foot down on the mat and see what is it like in Guatemala to deliver services for, Maya populations, and how does that compare with the populations that we have in Peru and so on and so forth. So that was, an example, an early example that is a really interesting way forward. So I'm all with you, Soumitra, on that. And in terms of proposals, I've always thought that these sort of, things that are now coming so strong when you're writing a proposal, like equitable partnership, community participation, I really push the funders to operationalize. What exactly do you mean by that? So equitable partnership, what will make a partnership equitable? So 50% of budget on each side, equal numbers of scientists as investigators in the proposal, all that sort of stuff. Why don't you kind of spell out what exactly makes an equitable partnership really truly equitable? And the same thing may apply to community participation. I think that will help a lot in terms of clarifying what it is expected. And if we do that, there should be a participation of people from low and middle income countries in deciding what is this operational definition. Thanks.
Thank you, Ricardo. Soumitra, I can see that you really need to say something immediately. I'll give you 1 minute to respond before I take it to the funders. You're on mute.
I'm going to be deliberately provocative and the devil's advocate to push this line. What Ricardo suggested is what scares me about Ricardo's suggestion is not that because it's bad, but because funders will quickly jump onto it and then tell themselves they've ticked the box and done the South-South collaboration, which it isn't. It's it's the beginning of a superficial way of getting people in the South to get to know each other. I was talking about South-South as in an organization in India saying, hey, we are going to help Mozambique to do some work. So we're going to ask for funding to do research in Mozambique because that's what we are doing. And a funder is a North funder, for example, saying, yeah, that's fine, we'll fund you for doing that. Even if you're based in the South and you don't want to do work in your own country. Now, if you see many funding calls will not allow that, okay? They actually set a bar on that. They will say, well, if you're a global South organization, you do work in that country and they want you to decide where the work is happening. So it's presumption that the Global South partners should always work in that Global South country. And the second thing is I wanted to say that the fact that you have students who come to us from Global North universities, spend time in Global South, learn a lot from the research and take those ideas back to the Global North to try and implement that. That's not what I meant when I said Global South could actually do research in Global North. That's not what I meant. Was completely different to that. That has always been the exploitative model that we've got. I was talking of a non-exploitative model, which is that you had Global South researchers and Global South students going and studying communities in Global North and funded to be doing that and maybe helping the Global North in some sort of way, as much as the Global North helps the Global South in some sort of way.
Great, thanks, Soumitra. So I'll give Priti and Tina a few minutes to respond. And I think if you can take up from what Soumitra and Ricardo have said, but also reflect on your role as funders, because like we've said, that people who hold the purse strings have some power in determining how the research is conducted. So then what is your responsibility as funders in actually helping your applicants achieve this meaningful collaboration or equity in collaboration?
So if I may go first, I think, and again, building from what everyone has been saying, if you want a meaningful partnership between the global North and South, between the funder and the applicant, or between South-South, um, the person who's having the power, in this case, the funder, needs to share that power. And I think sharing of that power, if I may say, will come in three areas. One is sharing of network. It is very important that as funders, we realize that because we are a funder, we may have access to different ideas. We may have access to people who are experts in certain work. And we share that knowledge with our partners. We also provide adequate budget for sharing of those knowledges. The second is capacity building of our partners. And this capacity building is not what the partner is asking as budgetary capacity building, but moving beyond budgets to look at capacity building, say, on how they can strengthen their communication. Because sometimes the partner may want to ask for it, but given that uh, they have experienced rejection, they may not go for certain course. And this is therefore beyond doing I would say core funding or going beyond unrestricted grants to say that we will build your capacity when it comes to communication skill, organization development, succession planning, and say that we'll facilitate that for you, provided that's a need identified by the partner. Also, very important to know that capacity building needs to be a need identified by partner, but continuously saying that we are available as resources and we are willing to fund that. I think the third is on localization and understanding that not always we understand all context. And even in India, we are a funder who does only mental health funding only in India. We already have 27 partners, and our ratio of getting partner on board vis-a-vis letting go of potential grant notes is also high. Despite that, there are instances where we feel we don't fully understand the context. And that's when we reach out to our own partners to say, can you help us understand this better? Can we learn from your knowledge about that marginalized group or of that geography? And coming to the question that Ricardo and Soumitra were talking about on what is equitable, I think sharing of this power and using it for the benefit of a partner is important. And I thought I'll take an example that we had where this is a collaboration between one foreign partner and an Indian partner, Indian entity. And we were looking at the proposal and we realized that in the proposal, it was said that the research publication would be done by the foreign entity. And we, as funders, said, no, we are putting it as part of grant that the local partner needs to be involved in writing of the research publication. We also realized that as part of the research, the data collection was going to be done by the local partner, but the analysis of that was going to be done by the foreign partner. Again, we used our power to say, no, we need to do the data collection and analysis also by the local partner. We do understand that the local partner does not have the capacity to do that, but we will go over and above what the local partner asked as funding to say we'll fund that capacity building. And then we did an entire 5-day program for that local program to build their capacity so that they could then participate in the research till the last mile and not just to a certain component. I would like to end this thing about partnership and power distribution by saying it's also therefore important that funders realize that they need diversity within their own teams. If you're going to work with marginalized groups, if you're going to work in geographies that are not your home geographies, you need to have people in your team who understand that marginalization, whether it be on caste, religion, or geography or ethnicity, to be part of your teams. To be part of your teams, not just at the time of application evaluation, but like as Tina was saying, how do you send out the call? How do you promote that? And that comes from team. As MHI, we continuously look at what's the diversity within our team. We have people with mental health issues, people who are neurodivergent, various marginalization. And of course, there are certain representations we don't have in our team. And we realize that and we say, okay, this is something that we are working towards having in our team. And frankly speaking, it just is so important because that perspective cannot come from an outsider. It needs to come from within the team. So I think it's also equally important we reflect upon how are we as a team structured.
Great. Thank you, Priti. Great points. Over to you, Taylor.
Thanks, Devika, and thanks, Priti. I think those are, well, I won't repeat anything that Priti said. I think she articulated it so well. And I'm in agreement with everything she said. I wanted to pick up on some of the points that were raised earlier around community research communities, innovation communities, the importance of them. All of our funding programs have what we call a program support platform, for example, that provides capacitation. And just as a sidebar, Soumitra, your point on capacitation of the funding organizations is well taken as well. It is definitely a partnership and goes both ways. So I do agree with that. But in terms of the innovation we develop over time, especially for programs that have been around for a long time, like the Global Mental Health Program or our Early Child Development Program. These are groups of researchers, innovators who have been able to meet in person virtually year on year for several years of funding. And I don't know if either of you, Ricardo or Soumitra, have joined any of those activities, but one of the pieces of feedback we get consistently is that's one of the most value add elements of GCC's funding, because they can learn from one another, they can share ideas. The point about South-South collaborations is interesting. I think it's also a factor of a stage of investment portfolio, though. We are now starting to see more collaborations between organizations that we've funded in the past that are now at a later stage of development, but it takes time. It's not going to happen overnight. And it takes a lot of work and a lot of resources and a lot of rounds of funding to get to a point where there's enough synergy identified between organizations to kick things off. We have several instances of this at the moment in Rwanda, for example, in our Early Child Development Program. That's our oldest funding program at GCC, so it's not surprising, but I'm hopeful that we'll see more of that. It's not something that we explicitly solicit, though, and it's not something we necessarily want to be overly prescriptive about. We don't want to be funding things that are artifactually connected just for the sake of having a South-South collaboration. And then in terms of localizing the team more, or bringing on or integrating local capacity into teams at funding organizations, again, I agree with that point wholeheartedly. We are a Toronto-based team. We're a relatively diverse team, but we are based in Toronto, Canada. So how diverse can we really be? One of the advantages, though, of working within GCC is that we're part of the Grand Challenges Network. And so we do have partner funding organizations in different countries like GC Grand Challenges India, for example, and BIRAC, Grand Challenges Africa, based in Nairobi, and a number of others, Grand Challenges Brazil. And so while we haven't fully leveraged those relationships yet, it is a goal to eventually work more closely with them so that we can be leveraging each other's resources. There's the local knowledge, the local connections, and be able to better support the organizations that we provide funding to on the ground. So I'll stop there as well. Devika, back over to you.
Great, thanks, Tina. It feels a little bit like you were put on the spot, but I think it's been a really, really good conversation where we've got to learn a little bit about how I think funders think, but also what some of the intended and unintended effects of some of your thinking can be when it actually reaches the people who are applying for some of these grants. We have some questions from the audience now. Before I go, just any last comments from our speakers about the 2 points that we've discussed?
Can I just say one thing, quickly? Several of you have mentioned the importance of the long-term investments. And I don't know of any organization, any funding organization that has that as one of their main things. The only one that has come up recently is Welcome Trust, that is offering some grants for 8 years. I do realize for government organizations that is very difficult because governments change and everything gets wiped out. And best example is the UK at the moment. But that's nothing changes overnight, you said, Tina, and that is my experience too.
We're making progress there though, Ricardo. We have just recently in the last year renewed our agreement with the Global Affairs Canada, and we have now a 7-year agreement with them. So it does give us longer runway than we had in the past. It may not be as long as is needed, but it's getting there. And that was based specifically on feedback from organizations we funded who said, look, it's just 2 years is not enough time, and it's not enough. This is not enough money to do what you expect us to do. And that was those were results that were resoundingly clear from an external evaluation, independent evaluation that was conducted on behalf of Global Affairs Canada for GCC. And it resulted in higher funding caps this go around and longer funding timelines. So that's loud and clear, and we're working on it.
Thank you. Okay, Priti, yes, go ahead, please.
Yeah, I just wanted to let Ricardo know that as MHI, we don't have specific indicators that we measure for impact. We always, unlike, yes, of course, we don't do a 8-year funding. I'll be frank about that. But we are ourselves 6 years old. So that's where we are. But we do say that we don't have fixed indicators. We ask the partners what is the indicator that they would like to track for the project. And we just ask them to submit that in any format they want. So, yeah, I'm all in for saying that let the indicators be decided by partners, because they do know the work that they're doing. And we ask them how best they want to measure their work.
Fantastic. Thanks, Priti. Yes, Soumitra.
I have only one complaint. You get 2 of the most progressive funders to come onto a panel like this, which is really not going anywhere. They're doing everything right. They know what is going on. They are at least self-reflective and self-aware. The challenge is addressing that vast number of funders out there who lack many of these qualities. So, it's almost becoming like, we're preaching to the converted, so as to speak. What we really need to be is getting this message across to the funders who really need to be hearing a lot of this.
Well, we're hopeful that Sangath's YouTube channel is going to get some hits today. But thanks for pointing that out. But I think that I still feel that there is a fair amount of nuance in this conversation that should hopefully be interesting to our very well-informed listeners. All right, so I'll just pick up 1 or 2 questions from the audience. There is one question from Aruna, which I think ties to a point that you had made early on, Soumitra, which was about organizations that are funding non-research work, so that organizations that fund service funders that fund service organizations. For grassroots organizations often feel very burdened by the power dynamic and feel unable to negotiate some of the contextual things that they understand. And on the other hand, funders are sort of perhaps hesitant to fund human resources directly. So any thoughts from anyone about how that can sort of be worked around?
So maybe I'll jump in briefly. In GCC's case, the budgets are sort of co-negotiated between the recipient and GCC. Obviously the first pass is proposed by the recipient because they know what needs to be spent, what needs to be allocated to what, for example. It should be due diligence on our side to make sure that the costs are all government eligible because they're taxpayer dollars, and we have a list of eligibility requirements. But otherwise, it is a sort of a co-negotiated budget, and human resources is definitely in the eligible cost directive. So I think it's a case by case basis in GCC's case. That's how I would respond to that.
Great, thanks, Tina. Preeti, do you want to say something?
Yeah, I just wanted to say, I think organizations that fund community-based mental health program do understand that, 80 to 90% of the budget cost would be human resource costs. And during COVID, none of the budgets have come down when it comes to community-based mental health. Actually, none have come down for mental health per se. That's because you are going to have those as a constant cost. Yes, it is difficult to negotiate as far as a CSO or a potential partner is concerned about the power dynamics. And like I mentioned before, I think it's up to the funders on how you negotiate that space, and being aware that you have power is a starting point.
Absolutely. Great. Thank you. All right. So we have 3 minutes left. I think instead of going back into questions, I'll invite everyone to take 25 seconds to perhaps present something that they'd like to end today's discussion.
Maybe I'll start us off just super quickly. I'm going to pick up on Soumitra's point about preaching to the converted. I wouldn't consider GCC converted. My closing point is really that it doesn't happen overnight. Change doesn't happen overnight. Changes are necessary in the funding, in Western funding models, and we're continuing to work on our approach to funding innovators in LMICs to reach the impact they're envisioning. And we are always open to feedback and how we can do better as a funder. So I just want to thank all the panelists on this call and Devika for this really super constructive conversation, and all the audience members. So thank you all.
Thank you, Tina. Soumitra, would you like to go next?
I just want to end by making a point which did not come up in this discussion, because I think it's an equally important point. If we want to see global South leadership in research and want to see more South-South partnerships, then we have to understand that very often governments in the South put regulatory barriers to that happening. And I think that governments in the South need to address that. So for example, very specifically to give you an example is in India, for example, the FCRA does mean that if I were to get, say, funding from GCC, and if I was a lead organization leading research in 3 countries in Asia and Africa, I would not be able to get the money out of India, which kind of really means that I have to find a partner somewhere in UK or Europe who becomes the lead organization, gets the money, and then passes it on to everybody, gives it out to everyone else to do the research. And that is not actually encouraging research leadership in the global south. And this is not a problem of the global north. This is a problem of the global south. It's a problem for the global south to solve for the global south. So while we keep on talking about what funders based in global north need to do, we also need to realize that maybe funders need to invest with global south governments to try and make them understand that how this is actually a very self-defeating idea. This is not helping anybody. This is actually not in their own interest to have these kind of restrictive barriers.
Well, for me, it's this is just one small battle in a long war. And I think we need to take the battle to where the big decision makers are. Say, for example, Gates Foundation that has never, taken mental health as one of their priorities. That's where the real war is going to take place.
I'll go next. Not from a war perspective, but definitely as a funder, I think summarizing what we all have been saying, that we need to be listening to the communities that we want to work with. As a mental health funder, we need to constantly see, are we challenging existing structures that are actually oppressive, that cause mental health? Let's not forget the cause for mental health. As funders, share power with our partners, and most importantly, as Tina has been saying, continuously reflect on ourselves and say, we are doing good, but we definitely can do better. So yeah, that's from my side.
Wonderful. On that very optimistic note, I'd like to thank all our panelists and all our attendees for this fantastic discussion. I hope that everyone has taken away at least something, at least one interesting thing that they learned today from this. I for sure learned a lot. Thank you all very, very much. And we will be organizing more webinars as part of Sangath's 25-year celebration. So please keep an eye on our social media. And thank you all once again. Have a good evening. Bye-bye.